everyone. We are going to show our research regarding behavioral aspects among passengers and crew members. And that is very important to understand how people feel and what their perception is in order to be able to implement successful preventive measures. As Barbara said the other days, there is very limited research on the topic, and that is what came up in our research. So this was a literature review that took place last year in December. And I'm going to show how this research was conducted. But first of all, to set the scene, I would like to refer to the definitions for those of us who are not familiar with CAP studies. It refers to knowledge, attitudes, and practices. Knowledge refers to understanding of any related topics such as infectious diseases, including COVID, HIV, influenza, etc. Attitudes refers to feelings towards a related condition as well as any preconceived ideas that one may have towards the condition. Practices refers to ways in which one demonstrates the knowledge and attitude through actions. All these are soft skills embedded in our culture. In other words, culture is our values, beliefs, and behaviors that are shared by members of a society and which provide direction for people as to what is acceptable or unacceptable in given situations. The aim of this study was to identify determinants that influence the spread of infectious diseases, as well as to identify facilitators and barriers regarding compliance with preventive measures. We did 2 systematic reviews. We consider articles that were published between 2010 to 2022. And the research was registered in Prospero. How did we start? First, we created a list of keywords that was communicated to partners in Healthy Sailing for their comments. And then we consulted the Sahlgrenska Academy Library to refine our survey. We considered for inclusion randomized control trials, cohort studies, cross-sectional and case control studies, articles that were published in English and French. And for more details, I have put in the annex at the end of this presentation more details, a slide with more details. We search Scopus and Web of Science. These include many databases, including PubMed, Social Sciences, Econly, and Base. And we also checked Google Scholar for comparison purposes. We used Prisma for the selections of the eligible studies. When it comes to crew members, we identify 584 articles, and for passengers, 851 articles. Those articles were uploaded in EndNote 20, and we removed duplicates. Then, the remaining articles were uploaded to Ryan, and 2 researchers independently screened title and abstract for eligibility. We created 3 categories: include, maybe, and exclude. For crew members, we found eligible 9 articles comprising of 5,200 participants. Two of the articles came from the Philippines, two from Italy, one from Senegal, one from Morocco, one from Montenegro, one from Kiribati, and one was a combination from Nigeria and the UK. Two articles were on COVID-19 and 7 on STIs and sexual health. For passengers, we identified 4 eligible articles comprising of 3,100 passengers. There were 2 articles on COVID, one on norovirus, and one did not state the disease. The articles came from Europe, one article, Atlantic area, that is North America and Europe, one article, Australia, one article, and one did not list the region. All studies were cross-sectional. So our efforts was to analyze, to synthesize in a meaningful way the findings. For this reason, we created a data extraction form with information about standard characteristics, and that was information about author, year of publication, study title, study objective, location, study design, participant characteristics, sample size, data collection tool, and main outcome measure. For the quality evaluation of the articles, we used the Joanna Briggs tool for cross-sectional studies, and the respective one for the mixed method studies. What we find, the findings were synthesized and evaluated according to knowledge, attitudes, and practices. Here I should say that knowledge was assessed based on 4 themes: knowledge about the disease, mode of transmission, symptoms, and preventive measures. I should say also that even though we wanted to refer to all infectious diseases, that was not possible because most of the articles were about STIs and sexual health. So the findings, when it comes to knowledge of crew members have a good knowledge about COVID, and we show that most of crew members, almost all of them, they have a good knowledge of the disease. And they also have good knowledge when it comes to the transmission. Almost all of them, they could name modes of transmission like coughing and sneezing and droplets. For the other end, half of the participants are knowledgeable about modes of transmission in STIs. They were not able to name modes of transmission from mother to child via breastfeeding, or no risk for transmission when sharing a meal. Again, when it comes to symptoms, most of the crew members, almost all of them, they were knowledgeable about the symptoms of the disease, and they were also knowledgeable about the preventive measures like face masks, isolation, or sneezing and coughing in the airborne. Only in one survey, the knowledge was not satisfactory. Now let's see what is the knowledge of passengers. Here I would like to refer to the Australian study, and that was done before COVID, between June and October 2019 via interviews. So passengers had limited knowledge of available preventive measures and sources about healthy cruising behaviors, even though the Australian authorities had published leaflets and information, and also they have uploaded a lot of information on social media and other and newspapers about healthy cruising behaviors. Passengers, in addition, they could not locate the medical facility on board. When they were asked repeatedly about this. They pointed out that they have heard that health services on board are very expensive, and therefore there is they hesitate to know the location of the medical facility and utilize their services. That was also backed up by the norovirus study. They found that 40% of the cases did not report their symptoms, either because they felt that it was not serious, or because they were asymptomatic. And like to keep in mind, please, that was done before COVID era. Now, they were asked, the participants were asked about the sources of information, what kind of information they use to increase their knowledge about the disease, and they pointed out media, including newspapers, television, radio, and social media platforms. They also talk with their family members, healthcare providers, and when it comes to crew members, they participate in training programs provided by the employer. Now, when it comes to attitudes among crew members, they have high levels of stigma and discrimination towards people living with HIV/AIDS. They believe that people with HIV/AIDS should not work on board ship. They also showed negative attitudes towards some preventive measures, such as the use of condoms. They believe that decreases pleasure, and also they believe that condoms are of low quality with many holes. In COVID studies, they have negative attitudes towards people coming from Asia, and that was a good thing that authorities named the new disease COVID instead of that thing from China. In addition, in COVID studies, the participants showed positive approach toward preventive medicine, towards preventive and mitigative measures like face masks and sneezing in elbow. Before COVID, the attitudes of travelers, mainly, they have in mind carefree time. So when they take a cruise, they want to have carefree time. And here I would like to quote a passenger saying that I don't have to worry about anything, said a male in his 20s, because the cruise company takes care of me, said a female in her 30s. Here we see that there are younger people who cruise, and perhaps they are more risk-taking. They show more risk-taking behaviors. Another issue that came up is that they have a high level of trust in the cruise staff. They pointed out the cruise ship is prepared. They cover everything. Now, when in the COVID articles, passengers feared of being infected with COVID while cruising, and they show positive attitudes towards good hygiene on board. They highly appreciated cleaning and disinfecting while cruising. They show negative attitudes towards the use of face masks, maybe because of the controversial information from different authorities on this issue. To continue with practices among crew members, when there were mandatory requirements from the employer, they showed good practices regarding seeking health services like medical evaluation of STIs. The same is also true when it comes to mandatory vaccination against COVID. When, on the contrary, when there were no mandatory obligations, no mandatory requirements for the employer, they showed good practices related to HIV testing. We have examples from Morocco and Montenegro where the seafarers had very low percentages of tests for HIV. Now, even though they have good knowledge, they have crew members, they show high risk behavior significantly. 8 out of 10 of them, they practice unprotected sex, and they have multiple casual partners. When it comes to COVID, the related studies reported good practices, and they show that 9 out of 10 wash their hands. They practice social distancing, 8 out of 10, and almost 8 out of 10, they use face masks. Passengers, what passengers did in the COVID era? They avoided crowded places such as dining rooms. And from the research in the norovirus outbreak, we were informed that passengers reduced participation in public activities, cases by 38% and controls 11%. So they did not participate they reduced participation in public activities. The passengers practice good hygiene measures like the use of hand sanitizers, 80%, and hand washing, 90%. 7 out of 10 of passengers, they bought and used more over-the-counter drugs, including sanitizers and face masks. Then they were asked about what measures can be used to increase awareness, and passengers pointed out that they want information proximal to travel preparation and commencement. They don't want one more app, but instead they prefer easy to access platforms like Facebook, like cruise traveler websites, SMS with links to more detailed information, and direct email or postal mail. This may B, because elderly people feel more comfortable with regular mails, uh, post, postal mails. When it comes to the crew members, they also pointed out media. Training courses provided by the employer, and these training courses should be obligatory and not optional. Limitations of the study, I would like to point out that there is very limited research on behavioral aspects, and we should consider prioritizing our research towards this direction. Because we are the experts. If we don't do it, who is going to do it? The articles, even though we wanted to include articles on all infectious diseases, the eligible articles, were mostly on STIs and sexual health, as I have said earlier. So the findings of this survey could serve as an indication only. The timing of the literature review that was done last year might also have an influence, and we are going to continue searching on the topic and update the publications. So all these publications will be uploaded on the Healthy Sailing webpage. Discussion. In general, we show that despite the satisfactory levels of knowledge, they showed poor attitudes, reflecting a pessimistic approach and perceptions. The findings clearly indicate that existing programs fail to be effective. They fail to. They were not effective in changing attitudes and practices. Perceived health risk from contracting diseases influence people's positive behavioral intentions, and it is crucial to understand the negative effects of a disease for engaging in preventing actions. To conclude, the crew members on board can take more proactive mode in instructing passengers without decreasing customer experience. Investment in cleanliness is central for marketing and operations during pandemics. From a policy perspective, it is important to communicate reliable information about the efficacy of measures, because false information or careless communication by governments and authorities can slow the recovery of tourism and can be detrimental to the shipping industry. We show that participatory interventions is very effective to enhance knowledge on the different infectious diseases. We should also consider strengthening collaboration among policymakers in providing evidence-based guidelines and information, and we should disseminate the information, the evidence-based guidelines, through trusted institutions and media. I would like to conclude by quoting a passenger from the Australian survey. My health is mainly the responsibility of the host cruise company. Thank you. Questions, please, if there are any.